Here we go. Okay. All right. Good. All right. So it's my real pleasure today, actually, to have Munir Ravalia on the call with us today. He's our special guest speaker, and I've been trying to get hold of Munir since last year, and I think we sort of arranged something last year, and then Munir had to go away. I think you were in another country, actually, Munir, at that time. I think you went to do some of your charity work abroad. But Munir does so much work within dentistry, and he's pushing the boundaries with what he does. I think by profession, and correct me if I say anything wrong here, Munir, but he's a dental sedationist with a specialization in physiotherapeutic and medical clinical hypnotherapy. I think I got that right. And I think you graduated with a dental degree in 2002 from Royal London Hospital. And I think you still work there, if I'm not mistaken. You do a lot of charity work. You do a lot of work with bees as well, and you're looking into Propolis as well, and how that can work within dentistry as well. Um, so I'm going to hand over to you. I'm sure this is going to be a really interesting subject we're going to go over today. We are recording, like I said, but over to you, Munir.
Thank you, Khalil. So me and Khalil have known each other quite some number of years now.
15, 16 years almost now.
Yeah, and he's been a wonderful mentor, my initial journey into the world of beekeeping. I'm a hobby beekeeper. I'm not a big apiotherapist where I've got hundreds of hives and have a business from that. It's more the medicinal properties of honey and of course propolis. I've delved into the last couple of years and worked with. I'm not sure if any of you know. So we just completed publication of the book called Propolis in Oral Healthcare with a world-leading expert, James Fernley, who has a large factory in Yorkshire, and he basically sources the world's high-grade propolis as well as other herbal substances globally, and then they test them in their factory to make sure that they are the real thing. Because we know, sadly, the online world can be a bit deceptive, and you can buy something for £2, but its therapeutic usage, whatever it is, can be very, very low, low to the point where it has no therapeutic effect. So they're not lying in terms of legalities that it's not propolis or the other substances, but the actual dosage in there doesn't actually have any therapeutic effect. So I visited James, I visited factory, we became very good friends. We met actually at the Apimondia, the world sort of congress of beekeepers and those involved in the bee world a couple of years ago in Turkey, and just became very good friends, to be honest. And then the rest is history, as they say. For some reason, this bar is on the bottom of my. Can you see on the screen just my lecture, or at the bottom, can you see the bar with all the different things on it?
On the bottom left, I can see a couple
Oh,
of.
okay, it's gone. Thank you. Okay, fine. So yeah, I mean, I work as a dentist. I work with very highly anxious, nervous patients. We sedate them, but I also use non-pharmacological, basically non-drug-based therapies to try and help people overcome their fears. But that's not the point of today. I just wanted to have a rough poll because when I was asked to do this by Khalil, I said, "Do you mind if I just throw this out to a couple of my dental colleagues?" And I did get quite a few responses. I can see a couple of my colleagues' names on the talk, but like with anything, life gets busy, and probably 99% of them haven't attended today. So I don't know. Can we do like a show of hands, or how would it work, Khalid? Just for me to get a rough idea. It's not going to change my talk, but I just wanted to have a rough idea of like if there's any dentists in the room. Just I don't know. Do you stick your hand up, or how can that work, Khalil?
Yeah, you can put it in the chat if they like, and then I
That's a
can
good one.
bring
Yeah,
that up.
just pop it in the chat. Just say whatever I mean, if you're just a beekeeper, you don't have to bother doing it because this is aimed at everyone. Um, so there are a couple are coming through.
A couple of hands went up then.
So that's great. So I just wanted to roughly know the audience just to see how I can scope the talk. But the talk is going to be general for us as human beings. It doesn't mean you have to be a beekeeper or a dentist to use propolis. Propolis is used very widely therapeutically by people, human beings. So we're just going to continue in that journey. So I just wanted to talk to a couple of people who maybe weren't sure or hadn't heard of what apitherapy is. It's a branch of what we call integrative branch of alternative medicine that uses the different products from the beehive for healing purposes. And we know that in Latin, AP is from the Latin apis, mellifera, honey-bearing tree, and obviously therapy from the Greek therapeutin. So we conventionally think of honey, most of us, especially if we're not beekeepers, honey as being the main source of something that's natural to heal. And this is actually a picture, high-powered photograph from one of my colleagues who's a photographer, and he took this off my beehive. This is going back about 10 years, but I still use the same picture because I think it's wonderful. And it doesn't show propolis only. There is an element of propolis on there, but it sort of shows the bees and obviously some of the bee wax. So that's just to understand what apitherapy is. It's a branch of alternative medicine utilizing the different things that basically bees produce. So we know that bees produce, amongst other things, the honey. We have propolis wax, royal jelly, the bee bread. But of course, we also know that, I haven't written in this because it's a whole separate topic and a lecture on its own, but bee venom therapy. And bee venom therapy was actually used in the United Kingdom. Unfortunately, the pharmaceutical world caught onto it. And I spoke to the lady, I'll be honest, I can't remember her name. I must have rang her about 15 years ago. I found a number in an old yellow pages. And I rang this lady and the number still worked. And she gave me the very interesting story of how, because the pharmaceutical companies wanted to make more money than they make, they went to the government and said, well, actually, you should stop this procedure because we can make doses of this so we know exactly how much we're giving. And this is the safe way of doing it, as opposed to someone getting a bee, sticking that bee onto someone's knee who's got an inflammatory disease like rheumatoid or osteoarthritis. And so we can't calibrate or standardize the amount of venom that's coming out. And sadly, she said she had to stop the procedure. The only thing they can do, and I don't know how this works legally, they've got some way of doing it, but they send the bees to someone who wants to provide bee venom therapy to themselves, and they basically have to sting themselves, but they give them like a little protocol to have an EpiPen, those kind of things, just to make sure that they don't have any anaphylactic reactions. So, you know, we can see on the market there are many 1,000,001 types of honeys these days. From around the globe, you can buy them, and then they're infused with different things. You know, ginger, turmeric, black seed, almost anything you can that doesn't ferment in the honey substrate, you can use in the wonderful products. But we've also got the royal jelly, and the talk for today is to discuss about propolis. So what is propolis? Very simply, it's a waxy resinous glue used by the bees. So they use it to physically seal the hive. So it creates like a draft excluder. It's very good because it's a waxy gluey form. And they use it to heal themselves. So that's the primary use and the primary reasons why bees produce it. It has obviously various constituents. A large percentage of it is that waxy resin. And then it has an element of pollen. And of course, the main properties that we look at in human studies is this percentage of essential oils that have very high antioxidant properties. So in terms of, if you were to simply think of what benefits propolis has for the human body, you can just basically categorize it very simply. It's anti-inflammatory, it's antibacterial, it's antiviral, and it's antifungal. So all the diseases that a human being can get, it's anti that thing. That's why it's so useful to use topically, meaning, for example, someone has a skin rash from a fungal infection, you can apply it to the body. But of course, we know taking a medication systemically, which means taking it internally into the body, either as a liquid or made in a tablet form or just the pure form, works inside the body and helps to boost an individual's anti-inflammatory capacity, boosts the immunity. So I see a lot of patients that I see who are generally, you know, a lot of people get colds in winter, they feel sick and they constantly run down, they get the flu. And so I advise them to take a high dose, what we call a loading dose of the propolis to just build their whole immunity up. And of course, I advise them as well to use things like honey and various other natural medicaments. Now, one of the main ingredients that is very useful, again, with its anti-inflammatory properties is this thing called CAPE, caffeinic acidic phenyl ester, long words, but it has this anti-inflammatory key element, but it's also has an antioxidant property, cytostatic. So it's been used in trials in rats, in those that have been induced with cancer, and it's found to have very, very, very useful properties. Now, because of the timing of this presentation, I don't want to go into the 1001 papers. If you look up in many of the alternative medical journals, there are absolutely hundreds and hundreds and hundreds of studies conducted. Some of them in vivo, and some of them, so those are like in Petri dishes, but they've also done some human trials. And I find a lot the Eastern Europe, places like Romania, Bulgaria, the Balkan states, as well as the Far East, places like Korea, Japan, they have a lot of studies. Unfortunately, a lot of them are not translated into the English medium. So unless you've got access to some sort of translation service or can get them translated, we are missing out as an English speaking nation, and for those who speak English, we miss out on a lot of these wonderful things that are being done globally, not only on propolis, but on a lot of natural alternative herbal therapies that are natural, not pharmaceutically driven, and are very, very useful. Like, our grandparents, many of us who are moving on in age, we know all those old remedies, the lemon, the honey, the blah, blah, blah. We all know these different things our grandparents have told us. And the reason they work is because they actually work in the body, and you don't need to necessarily pop a paracetamol or an ibuprofen to assist you in many, many things. But the bees basically collect the flavonoids from the resin from the plants, and then they basically mix that in with the wax and produce this basically waxy resinous glue, which is used as a medication for bees. But we're going to look at its use, obviously, in oral health care, but also how we can use it to boost ourselves, our immunity, and the immunity of someone who's maybe suffering. Because a lot of times, if we think of something simple as a mouth ulcer, there are some people who just get mouth ulcers. And generally, as dentists or us working in the hospital, we'll send them for various tests to make sure that their general blood markers are up to scratch. And a lot of times, no one knows why these people get this. But I found in these patients, if we give them a high loading dose of propolis, it boosts their immunity, and their recurrence of having something like an aphthous mouth ulcer reduces significantly. We're also going to look at how we can treat things like mouth ulcers very, very powerfully, because a lot of things on the market are aqueous, they're liquid form. So when you put that in the mouth, the saliva just washes it away and it doesn't do much. So we need something that can stick to the ulcer, stick to the gum, stick to the mucosa. And propolis is by far the only thing that can really do that, unless someone produces something which is, again, pharmaceutically driven. But we want to look at the natural elements of what we do. So how does it work? So very basically, it seals it damages microbes by physically sealing them. So no decomposition can occur. And in human studies, if we just simply think of the bacteria or the virus, the fungi being wrapped, it's wrapped and it's sealed, therefore it can't do what it wants to do, which is to replicate. That's how viruses, bacteria, and fungi overtake, because they replicate and then they bring down the immunity of the host. Us as human beings brings us down the immunity, and then takes over and then enters the bloodstream and does its damage. So there are a lot of studies out there where they've shown things like MRSA, methicillin-resistant Staphylococcus aureus, which is found a lot in hospitals. So people who are ill in hospital, they're already medically compromised, they're immunocompromised, their immune system's not working sufficiently. and they become more sick because they're in an environment of sick people. So there's more bugs and more things flying around in the hospital, and there's only so much you can do. You can't put people in a sterile environment when the people in the environment are not sterile. So they get this thing called MRSA, but they've shown, apart from antibiotics, which are now at a crucial level of the resistance, so we know that resistance with antibiotics is a serious global health problem, and the World Health Organization has marked this as a serious detriment to humans, because the more antibiotics we take, the more the bacteria get used to these, and then they replicate in different ways. And therefore, when you take the antibiotic, it doesn't do anything. So propolis and other, I'm not saying propolis is the only thing. Of course, there are other things, but we're talking about propolis today. So it has many ingredients in there that are very powerful to boost the immunity and prevent us getting the disease in the first place. So if we look at applications in dentistry and oral healthcare, some of these words, if you're not in the dental field, you may not be aware of, but I'll just basically think of them. If someone's wearing a denture, as an example, you can get ulcerations from the denture digging in the gum. You can get an inflammation underneath the denture, which is a stomatitis. Pericoronitis is very common. It's basically where someone has a wisdom tooth which is erupting. It's a very inflammatory process because it's digging through the gum, so it's painful. Erupting teeth in children. We can use it in root canal treatments to mummify the already dead pulpal tissue in the tooth, which gives the patient pain. A fungal infection on the lips, on the angle of the lips, called angular cheilitis. It's a fungal infection. There are, of course, medicaments we can use, but applying topically the tincture onto the corners of the lips, leaving that on, and taking a high loading dose of the propolis internally is a very natural way of treating this and a much faster way of healing. And that's one of the properties of propolis. So you can take all these wonderful pharmaceutical agents that we've got, but propolis heals things much faster. And again, as I talked about it, we can use it in ulcers, we can use it in a soft tissue lesion called lichen planus, and for other candidal infections. So there are multiple uses we can use it in dentistry. I'm not going to go through them in depth. Of course, this is not a lecture for dentists only, but I wanted to just give an idea of the many different ways that it can be utilized successfully in oral healthcare. So I'm going to look at a little bit of research. So if you look at this little paper on the top, it says Health from the Hive, propolis as an adjuvant in the treatment of chronic periodontitis. So periodontitis is gum disease, basically, where the surrounding aspects of the teeth, so we have the teeth, of course, which can become diseased, but the surrounding supporting structures of the tooth are the gum and the bone. So if someone has gum disease, bone disease, this inflammation of the periodontium, they did a microbiological study, and these are going back some time. You know, this is not something that was done in 2024. But it's again showing you research in Romania, Yugoslavia in the 90s, how successful that they found propolis in reducing inflammation of the gum tissue when applied topically to the gums after gum cleaning, using it as a mouthwash, and of course taking it as a internal systemic tablet or tablet form or capsule. They found the serious reduction in the progression of the gum disease and helping with the inflammation of the gums, which starts off as what we know as gingivitis, you know, the start of gum disease, which if not treated leads to the further destruction of the bone. And eventually that's how people get loose teeth and lose their teeth. It's a chronic disease, a bit like blood pressure, diabetes. A lot of people have these things. They're unaware of it because it doesn't affect them. And unfortunately, when it's too late, then people realize they've got the problem. So it's all about prevention at the end of the day. So this is the book that we've written. We've basically written it as a manual for anyone. It's Propolis in Oral Healthcare. It's not a book written only for dentists. Of course, we give a lot of advice and tips on how to dentists to utilize it on their patients. But we also, anyone can buy this book and self-heal, self-medicate. I wouldn't use the word self-medicate, but self-heal and use the propolis because it is a natural product which you can buy over the counter. It's not something that has to be prescribed. But it's not like a medicine, like a antibiotic or other formula that needs to be prescribed by a dentist or a doctor. Anyone can go and find a good source. And this is James's company in Yorkshire, and he's produced a whole oral health range. So they have a lip balm, mouthwash, they have the gel, the oral gel, they have the toothpaste, and the tincture. And why these are very useful is because they're very, the term I'd use is they're very inert. Propolis is a very inert material. It doesn't have any adverse reactions. So in terms of if someone's had oral cancer or got a very sore mouth, sometimes if you use if you use the pharmaceutically made mouthwashes and toothpastes, people find that they burn the mouth. They're very irritating. Whereas propolis is used in these sort of lower doses in a mouthwash and a toothpaste. I find patients who've had mouth cancer, as an example, there are obviously other conditions, inflammation of the mouth. It's very soothing. It doesn't burn. It doesn't sting. And then because it has the propolis in it, it speeds up the healing. It aids in the healing of whatever the oral health problem was, or whatever the oral health condition that needs stabilizing and treating. And of course, you can use it as a tincture. You can use it as a mouth spray if someone's got a sore throat, they're feeling those symptoms of the cold coming on, flu coming on, any laryngeal inflammation. They can spray it so it goes down the larynx, it goes down the throat. So you're not only getting that topical application of that, but because you then swallow that, you get the added benefit and application of using it systemically. So it's kind of a 2-in-1 benefit. And of course, on there, I haven't put the propolis capsules and tablets, which we can boost individuals who are feeling a bit run down. Like I say, a lot of people coming towards winter. There's quite a bit of a flu going around. People are feeling sick. So if you start these things and have a low dose every day, then you find the incidence of you feeling or getting these natural colds and bugs that we all going to get anyway, your reaction to them will be either significantly reduced, or you either won't get that common cold and common flu. So in the book, I go through different case studies. We go through different case studies, and we specifically write the treatment that you'd use the propolis and how to use it, because obviously it's in different formulations. So for example, on the left here, under where it says propolis treatment, it says dosage. So there we've given an example of where we would advise an individual to take up to 6 1,000 milligram units a day. That's a high, very, very high loading dose. You're taking the capsules, the tablets, and then you can either use the liquid, take 10 to 15 drops of that with 50% propolis. So these products have a very, very high range. And that's what I was saying. It's important when you buy it. But if you're a beekeeper, just make your own. You don't need to buy it. You can make your own stuff. But it's very high concentration, 50%. If you look at a lot of stuff on the market, it's unbelievable. Some of them have less than 1%. So they're not legally lying. It's legally acceptable for them to put propolis on it, but its therapeutic effect is literally zero. It doesn't do anything. It's like an antibiotic. If I tell you to take 1 milligram of amoxicillin, it's going to do absolutely nothing. The bacteria are just going to laugh at you. You need to have the high dose. So we need to hit this fungus or the bacteria or the viral infection high. Therefore, getting the good source, the natural source. And I always tell people also just speak to your local beekeeping association. The beekeepers are wonderful. They've got all of this in the hive. So, use it. So we've got an example here of a 72-year-old female patient with acute oral inflammation, poor health generally. So, high dose, loading dose. And then we go through different case studies. And of course, in the book, I go through very specific dental applications for dental infections, utilizing this instead of having to jump straight for the antibiotics. And like I'll just mention again, the reason why it's so powerful is because it's natural. There's no chance of resistance, as opposed to this world health crisis we've got of overuse of antibiotics, and then the antibiotics basically doing not much or not working as effectively, and then you need higher and higher doses, and it's just like a what's that word you use? basically like a circle that's never going to end, because the higher doses you give, the bacteria become more resistant, and then there'll come a point in mankind where the dose is so high, it's just going to be unacceptable. The body's just not going to be able to take it, because it's got to go through the stomach, it's got to be absorbed. People get sick, then you should really be taking antibiotics anyway with probiotics or prebiotics. But with this, you don't have to take them. Now, I'm not saying, and of course I treat hundreds of people a year that need antibiotics because they need them. They're sick. They've got a large facial abscess, which can become life-threatening. And we see obviously some of this in people work in A&E and oral maxillofacial surgery, oral surgery. A lot of times they're using antibiotics, but we can reduce the dosage and reduce the chance of having antibiotic resistance by basically bringing people's immunity up. And one way is through this wonderful use of propolis. So let's have a look at a couple of pictures here. This patient's got an aphthous ulcer, traumatic on the tongue. So we've applied, you can see on the picture on the right-hand side, this looks like this yellow gunky stuff. And because it's the resin, and I stated earlier on, it's the only thing that sticks to the oral mucosa. It sticks to it. So why is propolis so useful in oral ulceration? It's due to that reason. So when it sticks to the ulcer, the first thing it does is it physically creates a barrier. That barrier then allows that patient to be able to eat better without having that stinging feeling. So we've created this physical barrier. That's number one. And then, of course, through its internal properties that it has of being antifungal, antibacterial, anti-inflammatory, because it's an inflammatory process, it speeds up the healing of this ulcer significantly. I mean, within a day or two, 3 days maximum, the ulcer can go. For other people, it can last for a week or two, depending on the general state of their oral health. And of course, what was the etiology or the cause of the ulcer. Again, yeah, you can see this, what we call aphthous ulceration. The picture on the top left, you can see it looks very red, it looks very raw, it's very painful. So when the patient eats anything that has any spice element to it, any salt in it, anything that usually wouldn't aggravate the oral mucosa, when it touches that, it stings and it burns and it's painful. You can see it's been applied to the ulcer on the bottom. It's immediately sealed it, so you've got that immediate barrier. And the one interesting property of propolis is analgesic. So it has pain-killing properties. So the patient feels an immediate a relief from the analgesic property. They feel an immediate symptomatic relief because of the physical barrier. And now the healing process has started, and it will heal very, very fast. So it's very, very useful in what we call aphthous ulceration or generalized ulcers in the mouth. And of course, people who have different diseases, systemic diseases, they might have a disease in another area of the body, which means they become a bit immunocompromised, the body system shutting down a little bit, and they get mouth ulcers for those reasons. And of course, using the propolis as this tincture, the liquid, applying it to the ulcer assists, but then of course, advising them to use propolis high dose will just boost their immunity and help with all the other things that are going on in the body. So tooth eruption, this is for a child, or even if they've had a traumatic break of a tooth, we can use it. It seals the little tubules in the tooth, so you get immediate symptomatic relief of the sensitivity. If the dentist is, preparing a tooth or teeth for a bridge or a crown and they fall off, or before you even put your temporary on, you can apply this just with a cotton bud, a sterile cotton bud, and you can apply it, and it's very, very good for tooth sensitivity. And it's interesting, my father's had tooth sensitivity for the last 50 years, and he keeps bugging me because I've got no solution for him. And he says, but you're the dentist, you need to sort this out. He basically just overbrushes, so he's worn away all his enamel. And I said, Dad, why don't you just try this mouthwash? And I'll be honest with you, I didn't have a dream in the world that it would do anything. And he came to me about a week later and he said, that stuff's really good. It's reducing my sensitivity. I was like, okay, right, it does actually work. It wasn't just a fallacy that we were thinking. So it blocks those little tubules and helps reduce tooth sensitivity. And again, there it's been applied to this child who's got this sort of inflammatory response from this erupting tooth, and therefore applied to the gum. It's anti-inflammatory, it's analgesic, gives pain relief, and makes things just that little bit better for the patient, the individual, the human being. So this is what I was talking about, pericoronitis. You can see the picture on the left. That wisdom tooth is erupting. This is a very common problem we see as dentists almost all day if you're working in an emergency clinic. And of course, physically, people can become quite depressed about it because they can't eat properly. They feel run down. It's very, very painful. Bacteria just keeps getting in underneath the gum. It causes an infection. But locally applying it, so applying it, you can see we've applied it there. It's gone on the tongue and the other teeth because it's a waxy resin. It sticks. But it immediately, because of its analgesic properties and anti-inflammatory properties, it just calms things down, makes them better. No drugs here, no pharmaceuticals, no local anesthetic. Immediate relief. It seals around it as well, so less bacteria can penetrate underneath the gum. And of course, we need to then give them a high loading dose of between 3,000 to 5,000 milligrams a day. So if a tablet was 1,000 milligrams, that would be between 3,000 to 5,000. I usually recommend a patient, though, if they've never had Propolis or they're unsure, because of course we don't know if anyone's got any allergy. It's very rare to have an allergy to Propolis, but these days anyone can be allergic to anything. So I'd advise them to take a very low dose, 1,000 milligrams for the first 2 days, if it's not an acute problem, just to see how the body reacts. Make sure there's no any adverse. And I've never had anyone said I'm allergic to it. So if I'm happy with that, then I advise them to go on a high loading dose for about a week, very high dose, and then we can tailor that dose off. And then they can use a maintenance dose every day for really the rest of their life. My kids are a bit annoyed with me because every morning I'll say, "Have you had your Propolis? Have you had your Propolis?" And they'll be like, "Yeah, we had it. We had it." They're a bit fed up with me, but it keeps away the bugs. So this is an example of patient who had what we call a removable dental prosthesis, a denture. You can see a lot of people don't remove their dentures for multiple reasons. They find it annoying or they find it embarrassing. They don't want to put their teeth in a cup. And you can see on the left-hand side of the picture, it's very red, it's very raw, it's very inflamed. They've got this stomatitis, and they've got also candidal infection. So again, same thing, we get them to use a high dose systemically, but also they can apply it to the denture. When you apply it to the denture, then the denture sits on the gum, and it's basically like you've got a little medium of where the Propolis can stay exactly on where it's needed. And if you look on the right-hand side, after use of the Propolis, this is not obviously immediate. It's not going to happen in 1 second. It's going to take a couple of days. But you can see the gum. The gum looks less aggressive. It looks pink. It looks healthy again. So it's very useful for individuals who wear artificial prosthetics in the mouth to reduce this candidal or stomatitis infection that they have. So a few sort of what we call clinical tips, but this is for everyone you can use. So just check your patient isn't allergic to Propolis or any bee products. If they feel that their immunity is quite low, someone who gets colds regularly, then start them off on that sort of low dose initially, and then the high dose, and then they can have that maintenance dose of between 1,000 to 2,000 milligrams a day. You can utilize Propolis for yourselves. If you've got a mouth ulcer, just get the tincture, make your own tincture, and apply it to the ulcer. It will heal very quickly. And like I said, and I'll hit this home again, there's no product that you can buy in the market that will stick to the ulcer. All these Bongellas and gels, they're aqueous. So they just wash away, and that's why they don't do a lot. They might give a very fractional advantage, for a short period of time. But basically the Propolis sticks to it, and therefore its long-term inner effects of its anti-inflammatory analgesic properties will basically stay and stick to the mucosa of the mouth and just keep doing what it needs to do. There is a case study of using honey in dentistry in someone who's had what we call a post-operative infection. So someone's had a tooth extraction. They've had a nasty complication afterwards, which is called alveolulitis. It's basically, think of it as the clot disintegrates. It doesn't heal properly. And they applied honey to it. Now, if there are any dentists watching, they're probably thinking, well, hold on a minute. Honey's full of natural sugars. You're going to cause a decay. Well, we're not asking the patient to eat honey from morning till night. It's just used as a medicament in that area. But I'm sure there's probably a study out there that's mixed honey and propolis together and found that the rate of healing and speed of healing and the reduction of the symptoms from the patient being pain would have been significantly reduced, and the speed of healing would be significantly advanced. And this is not a joke journal. This is a National Journal of Maxillofacial Surgery. So these are peer-reviewed journals where you have to have some credence to publish things. You can't just publish things that have no weighting. And this was in, when was this? This was in 2014. So, I'm sure if I picked up the Polish Journal of Maxillofacial Surgery, which I can't read Polish, there'd probably be something equivalent or even more things that we don't even know about. So in kind of conclusion, I believe that apitherapy, the use of products from the beehive, is part of a healing spectrum. And therefore, if you incorporate it into a correctly formulated treatment plan, can benefit the patient. And in combination, so combination therapy, using it systemically, using it topically, will significantly improve the clinical outcomes for the individual human being the patient in my case. I've written a couple of articles. So this is in the British Dental Journal, and I wrote an article, me and Dr. Philip Wonder. He's now a retired surgeon, but he was a pioneer of Propolis in oral health care, and he's sort of passed on some of his work to me. And we wrote this paper, very simple paper, 2 pages, in the British Dental Journal, about bees and dentistry are the 2 linked, and we just basically talk about Propolis and what I've talked about. Then I give a little summary of how it can be used as for dentists, how they can use it. But like I say, Propolis can be used by anyone. You don't need to be a specific clinician to use it. Now, a lot of dentists panic because of the regulatory world. Oh, but what about the legal things? Can I prescribe it? Well, your patient can go down to the local health store and buy it, or buy it online. So, if you're worried about that, just tell them to buy it themselves. It's an over-counter medicine. It's not something that needs prescription. And I think there's a lot of future for it to be used routinely by clinicians, not only dentists, but any clinician, anyone working in healthcare, and very useful to not only treat problems, but to boost our patients' generalized immunity before they're having any surgery. So someone having an extraction, someone having any gum surgery or implant surgery, it can be utilized. So I've written this paper with a couple of colleagues. So James is one of them. There's a dentist in Uruguay, an amazing guy who's really pioneer in the use of propolis in oral healthcare. And Felix is an apitherapist in Indonesia. And this is in the Journal of Oral Biosciences. It's a very comprehensive paper. We go through basically all the literature, and we look at the good and the bad, and we basically show how powerful, through medical studies, the use of propolis is in oral healthcare and medicine. Because remember, if you're taking propolis for one thing, it's also going to help you with another thing. It's not target specific. If you've got a immune problem, if you've got a problem in the body, and you've taken it internally, then it's going to help with that as well. So it's useful in medicine. Oral healthcare is a branch of medicine, of course. So if anyone's interested, you can just Google it, get that paper. We can send it out to people. But it talks about how useful, and shows you the studies, the human trials that have been done to show how powerful. And it's not just this sort of mumbo jumbo thing that we've come up with because I like it because I'm a beekeeper. It's actually got a lot of science behind it. I think I've come up to my time. Yeah, and that's it really. I hope you enjoyed it. I'm just going to stop the share, but I'm not sure if there's any questions come through. I don't know, Khalil, if you want to just moderate.
I'm sure there'll be plenty of questions coming through, Munir, so don't worry about that. That was a very refreshing talk. It was really interesting. You went into some really complex methods and explained it really well. So thank you for that. And it's really refreshing to see that yourself being in the medical profession now, and you're probably surrounded by conventional medicine all the time, but you're looking at alternative methods which are, going to be free for most people or very cheap, or, they're better in a lot of respects than conventional medicine. So, should be applauded for your work that you guys are doing. I think that's amazing. Let me start off with a question then. I'll start first, and then we can get the ball rolling with anyone else. So, as beekeepers, a lot of us on this call are beekeepers. You had written down, certain milligrams of propolis and things like that. How would we measure that out as beekeepers? Because we've got access to propolis all the time. It's always, it sticks to everything, right? You know that.
Yeah.
How would we do that then? How would we measure things out?
I think very simply, let's take an example. You've got some propolis in front of you.
Yeah.
And you've got, just imagine a normal antibiotic capsule size.
Yeah.
Like amoxicillin, that capsule.
Yeah.
Fill it with propolis, and that will be roughly 1,000 milligrams.
Okay.
Very simply. It might be a bit off here and there, but as a general dosage, it will be about 1,000 milligrams, one tablet. Sorry, one capsule. And you can buy these gelatin-free capsules if you don't want gelatin.
Yeah.
And you can just, so if you were to kind of cut roughly, you could even cut, if you had a block of propolis, cut it to the size of a normal antibiotic capsule, and that would be roughly 1,000 milligrams. So 5,000 would be 5 of those, as an example. Very arbitrary. Yeah, so Sarah's quite nicely written for us there. A teaspoon. Yeah, I suppose, if you just have it a level teaspoon, not too high, would be about 5,000 milligrams because it's 5 mils. Yeah, roughly, yeah. I would say that's quite good, yeah.
All right. And what about tincture? Because how would we make a tincture if we were going to do that ourselves?
Well, that's a good question. I don't make the tincture because James makes it for me.
Okay.
I'll be lying if I said, but I know there's two methods. There's the one where you dehydrate it with alcohol. There's one where you use an aqueous solution without alcohol. And it's very interesting. When I went to the AP Mondia conference in Turkey a couple of years ago, there was a guy from Korea, and he showed a study that the extracted tincture without alcohol had higher properties medically for a human being through a study he did.
That's really
Because
interesting.
they found the alcohol one, it denatured, it killed a lot of the good stuff that was basically in there. So I'm still in touch with the guy, I can find out. But in terms of making it, I'll be honest with you, I don't make it, but I know there's two ways of doing it. And that's all I can say. You'd have to speak to an expert about that. I don't really know.
You know what the non-alcohol product was?
I think it was an aqueous solution of water.
Oh, right. Okay.
Yeah, with and glycerine, water and glycerine.
Okay.
I know
So I'll be honest with you, what I do is I kind of make my own tincture. What I do is I get propolis.
Yeah.
I put it in a little let's talk those jars. You get those you get a little jar, it's called, they're like I don't know, the yogurts or ice cream, it's called the goo ice cream pot.
Yeah, the little bowls.
The small ones.
Those little bowls. Yeah, that's exactly it. And if you got a Pringles lid, the Pringles lid fits on those bowls.
Okay.
Exactly. So what I do is I put propolis in there, and I just buy glycerine from Tesco's, just pure glycerine. And I pour the glycerine and I submerge. I try and break up. I don't have a big block. I break up the propolis. It's flaky, or you can just use a grater, grate it, put it in that little pot, and soak it in propolis and leave it for about 3 to 4 weeks. Okay. And you'll start seeing that liquid becomes like a yellowy, like that color of the propolis. And for me, that's my tincture. That's what I use. It's probably not going to be the highest concentration that you can do, but for someone who's just making it themselves, that's what I do. But it's not like a scientific thing. I'm not an expert in that.
Okay, no.
So is that what would you do? Half glycerine, half water, and then chuck in the propolis?
Yeah, I don't actually any water. I just use the glycerine personally.
Okay.
Yeah.
Okay, so one of the questions was what ratio of propolis to liquid would you use for ulcers?
What ratio of propolis to liquid would you use? So because I have the tincture, that I buy the tincture, I just use a couple of drops of that.
Okay.
So I suppose we could do the same if we're going to make it up ourselves.
If you can make it yourself, then yeah, as long as you just cover the ulcer, then you're fine. You'll be fine.
So could you, sorry, could you just get a piece of propolis and just stick it in your mouth?
Dab it on.
Yeah.
You could. It'd be quite strong, but
Yeah.
it wouldn't. It needs to be slightly aqueous for it to bond.
Okay.
Liquid to bond to it, but then stick to it. If you know what I mean.
Okay.
Yeah.
Okay.
Any other questions?
Does it stain your teeth? Oh yeah, that's a good one.
That's a good question.
Yeah. So be very careful. What I advise patients, if they're using the tincture, make sure you're not wearing your latest white Gucci t-shirt. Because if you get it on there, you're going to need to use some of Granny's recipe to get that off, because it's going to be, pardon my French, it's going to be bloody hard to get it off.
Yeah.
So yeah, it can stain the teeth. It's not going to stain your teeth for life. Don't worry. You don't have to go to the dentist the next day and get your teeth bleached. But you might get yeah. But if you just use a little bit and stick it to the ulcer, then it will just, the teeth that might be stained will just be in the area for, not a day or two. It's not going to stain them for life.
I've used Propolis myself when I've had like really sore throats, and just like put a small blob in my mouth and just
Yeah. I mean, some people just chew on it like a gum.
That's exactly what I did. Yeah.
Yeah. Some people just chew
might
on
be
it.
a bit strong, but it worked really well.
Yeah. There's a question from Rowan. It says, in your clinical practice, when a patient presents with a fungal infection in the mouth, do you reach for the Propolis as a first line of treatment over routine fungals? So because I've kind of written a book on it, it gives me a little bit of confidence to the patient, as they'll be thinking, who's this nutcase dentist who's telling me to use something from the beehive? So I would, obviously, it depends on my clinical environment. If I'm working in a hospital setting, it's much harder because, I don't have the rules and regulations stipulate you can't, but I can always tell them, well, this is the medicine we're going to prescribe you, the pharmaceutical thing, but have you tried properly? So I'll always tell them, because it's an over-counter thing. I'm not, doesn't need a prescription. So I'll tell them, get some, and I describe to them how to use it, like I've just told you. Take it internally. But then I'll say, apply it to your denture. Then when you have your denture in your mouth, you're going to feel that release of that inflammation, and it's going to heal up much faster. So I have no problem in telling people to do this. And I know that's Ronan asking as a dentist, and he's maybe a little bit concerned about the legalities of it. But you're not doing anything wrong. You're just telling someone to use something that you would use. You might tell your granny to use. So I don't see any problem with telling any other human being to do it.
Yeah.
Oh. Okay. So just before the questions start disappearing off the top,
yeah.
The gel's available. That's from Robin.
Gel, yeah. So the gel I get from the factory in Yorkshire. I can give people the details. It's the oral gel that basically James produces. He's made it, that oral health range. That's what I get it from.
Is his company Be Vital?
Yeah, that's it. Yeah.
Okay. All right.
Okay. All right. What was the other?
What was the website called? bevitalpropolis.com.
Yeah. There's another.
Well, there's a nice. Alison says something like, we've answered the thing about stain, but she's given us her life's case study of, she had a broken cap tooth, and she put the propolis, and it worked well until she had a hot drink. So my advice is, don't have a hot drink. How do you know the propolis is clean? Clean? Oh, do you mean straight from the hive? I assume she means that.
Yeah, I'm assuming so.
I suppose when you get it straight from the hive, it can have bits in it and all sorts. So you do.
Yeah, I mean, just, I don't know. If it's from your hive and you know that you've kept your hive within the parameters and there's no what are those little bugs that get in there, Khalil?
Varroa.
Varroa, yeah. As long as you're gonna go Varroa and whatever other funky ones come around there, I think you should be right.
Yeah. I suppose when we take it from the hive as well, most times you can scrape off the clean bits as well. Usually you can see if it's got like a bee stuck inside it or anything like that.
Yeah, exactly. Yeah.
You can clean it off. And I think some people, what they do is they freeze the propolis.
Oh, yeah.
They take it out of the freezer and then they grind it down. And then I think they put it in water, and then it all the crud comes to the top, and you can sort of remove it that way.
Oh, I see. Yeah. Okay. Yeah.
I've heard some people do that if they want to like be extra clean about it. You can do it like that. But from the hive, you can usually scrape off bits. What I tend to do is when I do my extracting, you have a lot of propolis around the edges of your frames. So I just scrape
exactly. That's what you get.
And keep that in a jar. So I've got a couple of jars of that now.
Oh, perfect. Yeah. Perfect. And then Sarah said, is it possible to forward this to my dentist? Yeah, I think you're going to stick up on YouTube. So yeah, go for it. I mean, if it's on YouTube, it's for the whole world.
Yeah. All right, good stuff. I'll send you the link, Munir, afterwards, so you can send it out to
Yeah,
your.
and I think everyone on this group's probably going to get the link. Is Sarah part of your group? Sarah Goff?
I'm
Sarah,
not sure.
are you
Sarah,
part of Essex?
Epping Forest Beekeepers.
Okay. Dentist, maybe. Okay. It is going to go out to the beekeepers.
Another beekeeping association. Okay.
Okay.
All right. We can send the link.
Do people have access to your YouTube?
It'll be on YouTube. Usually when we, well, actually, Munir, if you're happy for us to put it on YouTube as an open link, we'll do that.
Yeah, it's fine. It's fine.
Okay. All right. We'll do that then. Because normally when we put it on our website, we have it as you can only access it using a link, but we can make it public if you're happy to do that and everyone can see it.
Absolutely fine.
All right, cool. If you have a check then, Sarah, check on the Epping Forest Beekeepers YouTube site. Give it probably like 3 or 4 days.
Give us
I'll
a
get
bit
it
of
up
time.
there. I'll get it up there and you can have a look then. Okay, I have another question, Munir. At the beginning of your talk, you mentioned about how propolis might not be pure. I think you said that, you know the person you get it from. So is propolis one of these products like honey and everything else, which is adulterated as well?
Anything can be adulterated. Salt, baby milk.
Amazing.
Look at the crazy stuff that happened. There was in that place in China where you giving basically, I think it was like cement powder or something crazy, white powder, and they were selling it to mums for cheap, and all the kids in the village died because it had no nutritional effect.
Gosh.
So anything can be adulterated. That's why James, the reason why he's very cautious, because obviously his brand is well known and he wants to keep the standards. So they basically employ a laboratory technician, and his sole job is to check, because they don't only do propolis, they do a lot of herbs from around the globe, but they basically analyze them with some mad computers they've got. They stick this stuff in them and they grind them and they wash them and they put them in this and they put them in that, and they can basically tell you literally what country it's come from.
Oh,
Like
nice.
they can, like that. I don't know if you saw that program about the adulterated stuff coming from, I don't need to name countries, but it was coming from a country, and they were able to basically make a DNA profile, and through this DNA profile, they can tell you which country the honey's come from. It's madness. It's amazing. So that's what they do.
Same with propolis, I take it, right? Because
Yeah, that's exactly what it does.
And plants it comes from, so you can determine that. It's amazing.
I think they do similar things with olive oils and
Yeah. So you can check it. But I was just reading. Julia's given us some wonderful information about tinctures. She probably knows 10 times more than I do. I don't know if people just want to read it. 72% drinking alcohol draws out the best properties for propolis. Tincture could be up to 30% of propolis. Needs to stand for 4 to 6 weeks, then filter and bottle. Yeah, I mean, I'd agree with the principle of that it's probably useful, but I'd be interested to get the paper from this guy from Korea who found that non-alcohol based tincture extraction was actually more efficacious than the alcohol one. But I mean, that's a debate for another day.
Yeah,
I'm not an expert by any means on this, so I'm not going to claim I am.
That's one method anyway, isn't it, to do it?
Yeah, it's a method. I mean, it's a very popular method. Yeah.
All right, lovely. All right, does anyone else have any questions? What was that Cambridge beekeeping talk suggested that the fake food industry is bigger than the narcotics industry? Wow.
Wow.
I bet
That just goes to show how much money's in it then, doesn't it?
Well, I mean, it's. I mean, I think iPad, whoever that is, iPad, Mr. iPad, Mrs. iPad, has hit the nail on the head.
Yeah.
There's just so much, and it's not only about it being fake. Remember I was telling you about. There's a very famous high street brand which I probably can't name because I'll probably get sued, but they sell lots of tablets.
Yeah.
Right, and if you actually look at the active ingredients in there, they've got no clinical efficacy at all, and they're selling this stuff for. It's just a joke. The price they sell these things for. That's my personal opinion. It's not an opinion of the Beekeeping Association.
I think people don't look at these things enough, unfortunately.
Well, if you don't, you don't know. Until I was entered this field, I hadn't got a clue about any of this stuff.
It's like honey as well, isn't it? You look at the honey, it looks like it's pure British honey, and then you turn it around and read it properly, and it's like, actually, I don't know where it comes from in the world. So it's a similar kind of thing, isn't it? You just don't know, unless if you don't know, you don't know. You just trust what you see.
Absolutely.
Okay, anyone else have any questions? So it's coming up to 8:30 now anyway, so I think it's probably time for us to go and have some dinner.
Okay, well, thank you very much, Munir. That was fascinating. We will get this recording up in a few days, like Khalil said. Give us a few days. There is one last question. How does
Yeah.
time affect the Propolis quality?
That's from
Okay.
Richard.
That's from Richard as well.
Mr. iPad.
That will be from, yeah, that's from Mr. iPad. That's probably going to be the last question, I think, and then we're going to call it a day. So, Munir, if you're happy to answer that one.
I'll be honest with you, I don't know, but I look at it as like a fine wine. The more you leave it, the more it matures.
Okay, I see.
All right.
Good stuff.
Okay.
All right. Thanks. Thanks.
Thank
for
you
that.
very much. Thanks,
Thank you for
everybody.
inviting me. Lovely to see you guys. Take care.
And you
Thank
as
you.
well.
Yeah, thank you.
very much.
Munir. That was really good.
Thank you all for attending. Thank you very much, Munir.
You take care. Bye for now.
All
you.
right.
Bye-bye.
Take care then.
Yep.
All right. Thanks a lot,
Okay.
everyone.
Bye-bye.
See you soon. Thank
Bye.
you.
Thanks, guys. Thanks, guys.